All right, welcome back. As you notice, we're a little bit behind, but we'll try to catch up. But this is such fascinating and interesting things, and you can tell that we're all excited about this. So this next session, I'm looking forward to. It deals with complementary therapies. You know, what part of complementary therapies are value to incorporate in your management plan of living with Parkinson's disease, and are there any alternative or complementary therapies that you should be cautious about? We have the advantage of having three outstanding and knowledgeable specialists who will present their viewpoints. Again, as before, write down your questions on your 3x5 cards, and we'll try to leave time to answer questions. Those that we don't get to, you can either ask us afterwards, in between the sessions, and then we will also try to address them in writing through the MPF messenger. So our first speaker is Dr. Barbara Pickut, who's a movement disorder specialist and is the medical director of the Parkinson's and Movement Disorders Center at the Mercy Health Hauenstein Neurosciences Center. She's also an associate professor with Michigan State University in Grand Rapids. She received her bachelor's and master's degree from the University of Michigan and her medical degree and fellowship at the University of Antwerp in Belgium, where she practiced and taught for 20 years before we had the good fortune of bringing her back to the United States. She's been involved with a wide variety of research from basic to clinical, and most interesting to me is her work related to mindfulness, which she'll talk about now. So Dr. Pickut.
Thank you, Dr. Goodrow. Thank you very much. Good morning to each and every one of you. How are you guys doing? Great, yes? Good. It's a long morning. Please, if you can't hear me or if I speak too quickly, would you please just raise your hand? I'll try to be cognizant of all of you, okay? Being cognizant of things sort of is a good introduction to mindfulness. If I were to let myself go now, I would become increasingly nervous with having all these eyes on me. I notice standing before you that my palms are a little more wet than usual, and I'm sure if I took my pulse that my heart would be going a little bit quicker than usual. Now, when we learn meditation, does that go away? Guess what? No. It's important for us to always be aware of what's going on, and these things are automatic. If I had to tell myself I'm standing up straight now, my heart has to go quicker, well, you know, you guys would be out the room already. So we get a lot of things with the body automatically, and they don't go away. So we have been looking into when we have Parkinson's, our body reacts differently. And a lot of the automatic things that we were used to change. Isn't that the way we experience it? So mindfulness helps us in a way. It gives us a tool to look back at our body, to examine how things are going and seeing how we can help, how we may adjust. Now, I don't know where the forward and backward is, John. Is it on this thing? Ah. Okay. No? Oh, yes, thank you. So why, thank you, I'm sorry to make you stand. So why might mindfulness training be helpful for people with Parkinson's? We know what the cardinal symptoms of Parkinson's are, aren't we? Listen to me telling you. But we learned in school tremor, rigidity, akinesia, and postural instability. But of course, we know there's a whole lot more than just that. There's also things that we deal with like anxiety, pain, depression, and attention deficits. These are underlined because I'd like to come back to them in just a few moments. We looked at these non-motor symptoms in a group of people that we were serving in Antwerp, and we found that on an average, that this is not working. Yeah, I guess my left thumb does better than my right thumb. Anyway. We found that people, even in the very beginnings of having Parkinson's, that there is a substantial number of non-motor symptoms that people experience, and pain and sweating are among those. So when people come to us and ask their healthcare provider, what do we do about pain, depression, and anxiety? And by the way, I heard about some new therapy. People will come and ask us, what should we do? And if we're very honest, and you know, the doctors and healthcare providers have a scientific hat. We have to have a scientific hat. We may not always be able to tell you, recommend to you what to do. What we see that people with, I'm really having challenges with this thing.
Just hit page down.
Well, you want to hit page down? Which is page? Oh, where? I don't see a page down, but here.
Yeah, that would work too. Yeah. Or this one. There you go. Page up. So page up or page down will work there. It should.
Okay. Yeah, I'm an Apple person. I do apologize, but it's not. Oh, it's just slow. It's very slow. Yes, welcome to the real world. So why is the detection of non-motor symptoms important? Indeed, that people ask us how we might be able to help them. And when we look into the world of complementary and alternative therapies, we see that people with neurological conditions in general, and people with neurodegenerative conditions in particular, seek more help in complementary and alternative medicine. In fact, the U.S. National Health Survey has estimated that anywhere between 30% and upwards to 75, 85% of people with Parkinson's have used complementary and alternative therapies. I won't be going over all of these. My colleagues will be speaking with you about that in a moment. What are people looking at? What are people using? You see a list here that I won't go into. I'll leave that for you all. But just let me bring your attention to meditation. Here you see a list of any complementary therapy in this particular study. This was a single center, multi-site study in Colorado. And what we see here is what has the biggest impact on quality of life, how the people felt about it, was, for example, spirituality. When asked what had the biggest impact on mood, you see that meditation, people reported an 80% increase in improvement of mood after learning meditation. Now this was a Colorado study, so you see for sleep, people were using cannabis and they reported a 55% improvement. Energy, yoga was named as one of the toppers, and for the motor function, massage seemed to help people. So coenzyme Q10 we'll hear more about later, and creatinine, glutathione. So I want to bring you now to let you know something about, and by the way, I'm going to keep this short. At 1 o'clock we're going to be speaking about mindfulness again, so I just want to skip some of these slides. I don't know, but you see it's not, yeah, I'm doing my best, guys. Excuse me. So, as a neurologist standing before you, in conclusion about this type of material, people come to us and report that under stress, and when I say people, I mean people with Parkinson's, come to us and report that under stress, symptoms increase. Standing in the supermarket, trying to get the change out of the pocket, a number of things. We notice that with stress, symptoms increase. This is also published in the literature, both motor and non-motor symptoms. We know that people with Parkinson's seek outside of the conventional environment for help. with their symptoms. And there is a precedent that mindfulness may have an impact on some of the symptoms that are similar in the non-motor symptoms with other diseases, such as people with depression, people with pain. Here you see a number of studies, and you see how far back these are going. Mindfulness as an intervention has been used back in 1982. In fact, mindfulness training was first developed as an intervention in a hospital for people with chronic illness and pain. We see it on the cover of Time as if it's something new, the New Age gurus who are coming out of the ashes, but actually this material has been around for quite some time. Can you hear me in the back? So meditation research has been taking off. You see here an exponential growth in the number of publications in cognitive neurosciences. So the study of people meditating has given some interesting data for us to be able to help ourselves as healthcare practitioners, because we need it too. When we're in the room together, there's two or more of us. It's not an isolated act. So one of the things we're working on too at Mercy Health right now is physician burnout, and looking to see how these particular techniques might help support the dyadic or larger encounter. I show you this rather busy slide just to let you know. I don't know if you all remember, there was a big splash in the popular press some years ago about the fact that meditation makes the brain grow. Well, this was based on this first study here, Sarah Lazar from Harvard, who was one of the first people to show that there is indeed, or seems to be, brain plastic response to meditation. That actually in this community of people that she studied, it was a cross-sectional study and there's some methodological issues to this, and maybe there's some particular brains who rather learn to meditate and others who don't. In any case, long-term meditators at the age of 50 had the same cortical thickness, the same amount of brain structure as the 20 or 30-year-olds in this particular study. It was age matched, education matched. So this is interesting data. I don't have time to go through all of it. Let me tell you a bit about what we found, particularly in people with Parkinson's. The definition of mindfulness we'll go over later at 1 o'clock. If anyone's interested, we'll have some more time to present then. I just want to, with respect to my colleagues, leave enough time. So what I would like to say to the people who won't be coming back at 1 o'clock, mindfulness is a training. That is to say, when we want to change the brain, just like learning to play an instrument, play the piano, or be a taxi cab driver in London, in order to change the brain, we have to practice. Can we change our brain when we have Parkinson's? That was one of our questions. And yes, we found that after 8 weeks' time, certain areas of the brain in people with Parkinson's actually got larger. Parts of the brain that even have something to do with Parkinson's. The inclusion and exclusion criteria of our study are quite classic. We took them from pharmacological studies. I'm having slide issues. There were 30 people in the study. Half of the people, and this is for an imaging study, which is okay in terms of size. Half of the people in this study using mindfulness, learning how to meditate, half of the people started right away with the 8-week program, and half of the people were on a waiting list. So before the study started, we took a brain scan of all 30 people. People were then divided into 2 groups. those following the mindfulness training and those waiting. And then at the end of the 8 weeks, we took a brain scan again of the whole group and compared the brains of those who had had the training to those who had not had the training. These people were age matched, education matched, sex matched. This is the whole data that you just saw there, which is not, it's really interesting. I don't have up, oh yes. Go back. I'm so sorry. What we found is, I'll just tell you what we found, the pretty pictures. There's really a lag in this. Is it because it's presenter's view, maybe? That there's such a lag? Yeah, but that's probably what's going on. I would suggest you guys don't use presenter view. We found in the people who followed the mindfulness training, we found that in the area where memory is kept, for example, at the hippocampus, where we see that people with Parkinson's may have atrophy, in this study, in this particular group of people, we found that that area was larger in volume after the study. The amygdala that we know has atrophy in people with Parkinson's also became larger. Is that a good thing? Is that not a good thing? That's discussable. We saw in this particular group of people that the occipital lobe increased in volume, and we know from some studies that the occipital lobe is one of the areas of the brain when we have Parkinson's that shows atrophy very early on. Another unique finding in this study was that, well, you know, when we have Parkinson's, let's say I have Parkinson's now, I'm left-handed. So maybe I might have more chance of having my Parkinson's develop in my left hand, the dominant side. My right cerebellum is going to help me correct for any motor deficits I have in my left hand, yes? So when we have Parkinson's, half of that cerebellum adjusts, helps us adjust. What we found in our study was that after the study was finished, the people who had the mindfulness training had less pull on their cerebellum. The other side of the cerebellum in the study group remained larger. So that's, for me, that's probably the most interesting finding scientifically of this whole study. It's been published that the cerebellum works in a compensatory fashion. So, my dear people, thank you for your patience. It's been a little bit bumpy ride with the slides. We have decided this with the speakers together that we will be, oh, jeez. My talk is over.
So, apologies to Dr. Pickut. I'm not really sure what was going on with the slides. I've never actually seen PowerPoint do that before, so I couldn't really help with something I've never encountered before. So our next speaker is Dr. Shana Krstevska. I'm not going to try to butcher your name any further. Perfect. But she's a movement disorder specialist at Henry Ford Hospital in Troy. More recently in West Bloomfield. She received her medical degree at Wayne State University and took a movement disorder fellowship under Dr. Peter LeWitt. She's a member of the Michigan Parkinson's Foundation Professional Advisory Board and its past chairman. And we look forward to her comments, and hopefully we won't have slide issues. But I can't even get the mouse to work now. Well, I could if I had. Yeah, I can't even get the mouse to come back. I got no. Oh, here it goes. All right.
I don't have a cape, but maybe I can use a mouse. Are you doing okay?
PowerPoint's lagging. not sure why.
Is this the presentation you want right here?
Yeah.
Okay.
I already hit presentation view and it's not even popping that up.
Okay, if you need a presentation view, just take me 1 second to convert this, okay?
Okay.
Please stand by, everybody. It'll be 1 moment. It's what they say on TV, right?
Is this a map?
Okay, that should be good. There you go. Okay.
Are we good now?
That you've got your outline view, is that what you wanted?
Yeah, perfect.
Okay.
Yeah, okay.
Okay.
Yeah. Is it working?
Got this. So this one is forward, that one's back. Okay.
Okay. Hello. Hello, it's such a pleasure and a wonderful opportunity to get to meet some more patients and share some of my passion and my outlook, how I look at patients and look at life. We will try to make this brief and so we can have more opportunity for a discussion. How do we look at when we think about complementary medicine? What is medicine? I mean, if you are looking and if you're talking to a Native American person, they can say to another friend, you are a good medicine. What does that mean? It means that having a conversation with a good, trusted friend can be very soothing, very healing, and actually a medicine for that person. You can all think of running into people that you just increase your joy, and it's or running into someone that may be critical. That can be a bad medicine. So when we look at complementary, what does it involve in the healing and the well-being of a person? Scientifically, from medical term, as a neurologist, we're trained to look at facts, look at the body, look at the disease, and try to find treatment. Sometimes, most of the time, unfortunately, what we have is a symptomatic treatment. We don't have a cure. We don't know why. And my objective here is to really look at each of my patients, and when I see them, to empower them to think of the body, mind, emotions, mind, soul, and physical aspect as one. We do not have a separation. Unfortunately, clinically, we're always looking at, do you have pain? Do you have a disease? And this is the medication. What can we do to empower ourselves so we can have the most out of every day? The question is always, why do I have Parkinson's? Unfortunately, the questions that we have for why put us in the victim land. The why does not give us answers. So put us in feeling sorry for ourselves. Why do I have this? What's wrong with me? And does not help to make the most out of every day. So I am very supportive and very excited about the mindfulness that Dr. Pickut will present later. Because even if we have some time just to sit, we don't have to have a particular technique or a lesson. And certainly if we learn a better technique that we can get into a relaxed state sooner is wonderful. But having just time for 10 minutes just to breathe and focus only on the breathing can be healing, because it takes away the mind from the chatter and the worries and the blame and the whys. So mind, body, prayer. Different people have a spiritual beliefs, and I believe that there is God or a universal intelligence that we can ask for guidance or for assistance as we are meditating, praying, and taking that time to acknowledge our feelings, our thoughts, and what is happening. So we do ask the patients, to find, to describe to us, usually, when, we see them in clinic, what happens in a 24-hour? What do you do for fun? How do you honor yourself? I have seen amazing results with patients that were very limited because of the diagnosis and forgot to live. And going on a cruise, going on vacation, seeing friends, focusing on what can we do for fun. How do we embrace joy? Parkinson is just one aspect, just patients that are having diabetes, hypertension. That does not define them. I mean, that is one aspect. It's not all of it. And what we think makes and supports our beliefs then transform into action, and our actions then determine who we are as a person. It changes our personality. So I just wanted to share some of the vitamins that I like to, that I use, and they have been studied and supported. Certainly fish oil for patients that, I don't know if, did we go here or? There are many modalities of treatment. Mood, depression, inflammation. All the psychiatric literature does support using fish oil for patients that are refractory, are not responding to multiple antidepressants, and typically 1,000 milligrams twice a day. Of course, always the concern is about mercury. Where is the source? Where are we getting our supplements from? You can get a prescription fish oil called Lavazza from your doctor. Sometimes, of course, we have to fight with insurance if it's going to be covered or not, and the cost of it. Adeplan is a prescription high dose of folic acid that is approved and used in psychiatry for depression, and some patients may have found that Adeplan alone can be significant in changing mood and how we feel. Certainly, as we mentioned, meditation, yoga, vitamin D has been discussed. We certainly have literature to support that patients that have multiple sclerosis had less relapse with a normal levels of vitamin D. And magnesium, B complex are also in this placement. Allergies. Why do people have allergies? We always are asked, can I use Benadryl? We don't like using Benadryl because it can cause worsening of cognition. And certainly quercetin can be used as a natural antihistamine. Stinging nettle can be, that has been used in Europe for many years. It does actually increases iron in the system for patients that are not able to tolerate taking iron pills and are anemic. And it also detoxifies the liver. One of the major things that I'm very pro about, I find that again, we have to go back to basics. So at one point, it was believed that our food should be our medicine. So with, changes in what we are eating, we're importing things, we're eating more out of a box with many preservatives. I believe, again, what is the simplest way to support our body? How do we care for ourselves. So I do advocate eliminating sugar. I look at it as a crack cocaine. There is no nutritional benefits or value to it other than just a quick or short pleasure of having that creme brulee that has 2,000 calories, which I have been guilty of myself. But when we're looking at, with the thought of disease as an inflammation, we need to look at what are we putting in our body that can result in inflammation that is not supportive and healing for us. So I would definitely, my thought is to eliminate sugar, gluten. We can eliminate, at least for a month, dairy and eggs to see you may be sensitive to certain food that can cause inflammation, that after a month you can gradually introduce some of the food like the dairy, eggs, or grains to see what is happening. How do you feel? Many people have this fatigue, brain fog. We have been able to determine that some patients do have celiac, but many people, when they're tested for celiac disease, will test negative. But again, when they eat bread and grain, they don't feel good. They're foggy, less energy, there are more inflammation, swelling of joints. So I believe this is a very simple way of taking charge of what are we eating. Is it serving us? Is it helping us? Or is it hurting? Sleep. We all need sleep. It is time for us to regenerate, recharge, and heal. Many patients with Parkinson's disease, and as we age, sleep is interrupted for many reasons. Melatonin has been used even in children and across and for sleep. Some of the talks and studies are saying that we can use melatonin 3 milligrams at bedtime. Some believe if this is not working for you, or people, you have tried melatonin at bedtime, you're not getting the benefit, 4 hours before bedtime seem to have been helpful for some other patients. Valerian root is in drops and is calming, or passion flower. There's tea that you can find in many places. This, just to go over, certainly this is in many degenerative diseases. A caveat here, we have to look at the whole picture. These are just as an example, but again, we want to make sure what are all the medication, what is happening. I'm not advocating that we stop taking cholesterol medication and replace it with rice, red rice yeast. If you're taking cholesterol medicine, either you take the cholesterol medication or you take the red rice yeast. There's a T missing here. Certainly, fish oil, flaxseed oil has been helpful. Again, our diet can be affecting what we're eating. We know that patients that are taking statins, medication to lower cholesterol, they need to supplement with CoQ10 because that is decreased and depleted. Initially, when they designed the medications, they should have added it, but cost and all these other things, it is important to add that to the study. Yes, the Parkinson's study group did do a study to see if that was preventive or helpful. Just because it was not statistically significant for that study, I do believe if you are taking statins, you should be taking CoQ10. Constipation is a very important part of patients with Parkinson's disease, and as we age as well, and other neurodegenerative disorders. We have Miralax, we have laxative, we have different things that we offer, but I do believe that magnesium citrate, which is absorbed better, at the right dose can make a huge difference for patients. The only side effect from taking too much magnesium is diarrhea. Magnesium has many beneficial properties. We use it in migraine, we use it with headaches, muscle cramp, muscle stiffness. I do find it to be very helpful, and there is no adverse effects to that. Probiotics are very important. The higher the strain, at least initially in the first few months, helps to repopulate and give us a better benefit, because we certainly know there are many precursors, and we, with the diet and the sugar and everything, that our preservatives that we use, we have, and certainly antibiotics have eliminated many vital strains that we do need. So I have so much more to say, but I know I probably ran out, and I'm going to let Dr. Taylor take over. Thank you so much.
Thank you, Shana. I think you'll get a common theme for all these topics is there's more to go over than we have time. I'd like to now introduce Dr. Danette Taylor. Danette is the head of the Movement Disorder program at William Beaumont Hospital in Royal Oak, where she's recently created a very nice multidisciplinary clinic to cover all aspects of Parkinson's disease. She's a graduate of my college, Michigan State University College of Osteopathic Medicine, and did her residency at Botsford Hospital, and is actually one of the people that got me interested in neurology to begin with, so she's part of the reason that I'm standing here. She probably knows that. I don't know if she does. She's a member of the Professional Advisory Board of Michigan Parkinson's Foundation, and is currently an assistant professor at Oakland University Beaumont School of Medicine. And her research covers clinical and practical aspects of management of Parkinson's disease, and in particular, driving issues related to neurodegenerative diseases. Dr. Taylor.
Thank you, Jim. Okay, good morning, everybody. It's still morning, I think, for another minute. So we will try to get my program set up here. Hello. I'm having the same issues that poor Dr. Pickut had. That's fine. If we don't have my slide, that's not coming up at all. So if we don't have my slides, I actually have them written down. Just to give you the heads up on what I'm going to talk about today, I am the original skeptic. And so today I'm going to talk about things that don't work, things that we really want to work, but unfortunately haven't been proven. And we've learned that in medicine, unfortunately, while we want to say that, wow, it worked for my neighbor and it worked for my uncle, I really want it to work for me. But there is a notable neurologist that has specifically stated a number of anecdotes does not equal data. And so we do sometimes have to look specifically at what is the proof regarding different therapies that are available. Thank you so much. And so that's one of the things that I want to briefly talk about. And I know that lunch is waiting. I know that we all have a lot of different questions and so on. But we've heard that there's a lot of good scientific data behind not just the medicines for Parkinson's disease, but for the complementary medicines, the complementary supplements that we want to use. Now, why do we choose complementary medicines? Because sometimes the proven medicines or the, quote, typical medications, Western medications that we have that are available don't necessarily work for us. They don't do what we want them to do, or they give us side effects or other problems, and so that becomes an issue for some individuals. And when that happens, then we worry about, well, what else might be available? What else could I do? And so we start stretching out for other things. Now, this seems kind of a snarky comment, and for those that can't read it, it says, all those who believe in psychokinesis, raise my hand. If only we could do that. So, but again, let's go back to that skepticism. Let's go back to that doubting Thomas component. We want proof. We want things that we know are going to make a difference and that in the scheme of things aren't going to hurt us, or in the long run are not going to hurt us. And so when we take a supplement, if we're going to look at a supplement, and there are multiple supplements that are available that weren't even brought up today, mucinoprurians and fava beans and a number of other factors that we look at. What can those really do? And how do you know that they can do what they claim to do? And how can you confirm whether a supplement is going to say what it can do, it really do? And what proof do those companies that create these supplements actually have to submit to anybody to back up any claims that they're making? Do you guys know the answers to these? Dr. Goodrow hit the nail on the head. Nothing. If you create a supplement, you can just put it on the shelf at your favorite store. You do not have to submit anything to anybody to back up your claims. The best that we see is that little asterisk and the microscopic print at the bottom of a poster or something else that says, these claims have not been evaluated by the FDA. There is no proof of benefit from this supplement. That's what we see. And sometimes the supplements that are sold on the shelves aren't even what they claim to be. How many saw the recent study that was posted in the New York Times looking specifically at supplements that were on the shelf? And what it turned out to be was most of the supplements that claimed to be supplements were really fillers. The active ingredient for those supplements wasn't even in the bottle. So that's another issue. So how do we know if something can work or can be available? There is a company, it's called USP, U.S. Pharmacopeal Company, that will, it's a voluntary organization, or companies have to voluntarily ask this company to give them a, quote, seal of approval. It's kind of a seal of, like the Good Housekeeping seal of approval for supplements. But most supplements don't pursue that for whatever reason. So you can find out if there is any data behind a supplement if you go to the National or the Natural Medicine Comprehensive Database, and that's an easy thing to do. Just do an online search. What data is behind the claims for this specific supplement? What proof is there, if any? And so, bottom line, buyer beware for the supplements that you are purchasing, and keep that in mind. So let's talk specifically about a few other things that are on the market. You guys know what these are? Yeah, absolutely. As my son once said very famously, coconuts are good. So, coconut oil. What does coconut oil do for Parkinson's disease? We know that it is filled with medium chain triglycerides. And there's actually been some studies looking at medium chain triglycerides as an alternative fuel for the brain for people who have dementia like Alzheimer's disease. But we heard earlier today that Alzheimer's disease isn't Parkinson's disease, and even the memory problems associated with Alzheimer's disease are very different from the memory problems associated with Parkinson's disease. And certainly the movements that we see with Alzheimer's disease are very different from what we see with Parkinson's disease. And so there has been, in fact, some benefit identified or suggested for patients with Alzheimer's disease with medium chain triglycerides being utilized as an alternative fuel source. But there's not anything that has been shown to be of benefit for anything for Parkinson's disease or any of the symptoms for Parkinson's disease. So enjoy coconut oil. If you use it, that's fine. Don't expect it to necessarily make a big change. Okay, glutathione. This is a big issue. There's a lot of people that really feel that this is beneficial. Theoretically, patients with Parkinson's disease don't have enough glutathione, which is a building block to help create and utilize dopamine within our brain. This medication or this supplement has actually been looked at, and I have two specific quotes. I usually hate to do this on slides. I thought these two quotes were important enough to actually just give to you in verbatim. These are from the National Parkinson's Foundation. It is important for patients to be aware of several facts about glutathione therapy. One, there is a lack of evidence that it actually works. Two, the therapy does require an IV line, which has significant risks for patients. Finally, this is an out-of-pocket cost for you. Insurance does not cover this whatsoever. And this is the take-home message from the National Parkinson's Foundation. There is a clear message for patients and families regarding glutathione. There exists no compelling evidence that IV glutathione results in any meaningful clinical improvement in patients with Parkinson's disease. And patients should be aware of any medical practices offering glutathione treatment for a fee. And so that is absolutely something that you should be aware of. So if there are people that are telling you, we will give you IV glutathione, it is $1,000 a treatment or $2,000 a treatment, which are typical going rates for that therapy, please be careful, be cautious about that. So, and then finally, stem cell therapies. We want stem cell therapies available today. We want them to work. We want them to be around. And we know that stem cells can be differentiated into other cells, even within the brain, which is very exciting news. But stem cell therapy for patients with Parkinson's disease, not yet available clinically. It is still under research, still underway, lots that we need to do. We know we can turn on dopamine-producing cells in the brain. We haven't yet figured out what the checks and the balance system is and how to rein those dopamine-producing systems in, or cells in, so that we don't cause other problems or significant side effects. And so we've got a lot to do for stem cell therapy. Even so, we need to figure out what cells are really going to be best, how do we grow those cells in quantities, and how do we actually get them into your brain so they're going to make a difference. We know that if we give stem cells as a shot into the muscle, it's not going to do anything. If we give stem cells through an IV into your bloodstream, it's not going to do anything. So again, please be cautious about what is there. So what can you do as families, as patients? Number one, join me on the side of doubting Thomas. Be a skeptic. Ask questions. Be open with your doctor. Say, you know, this medicine that you have prescribed for me, A, doesn't work. B, I'm worried about the side effects. C, my insurance doesn't cover it. I'm worried about the cost. Is there something else that is available? Have that dialogue. And if your doctor says, I don't have any time today, say, when can I schedule this to have the time to have this discussion? This is an important topic for me. So please be open, ask questions. Ask as many questions about supplements that you want to use as you ask about prescription medications that are being supplied or prescribed for you. I have many patients and families come back to me and say, well, what will this prescription medication that's being prescribed for depression do? And what will this prescription medication being prescribed for the Parkinson's tremor do? And what will this prescription medication being prescribed for urinary incontinence or urinary frequency do for me? But nobody ever comes in and says, well, what will this supplement do? And what is the proof or the research behind it? So ask as many questions about supplements that you are interested in or that you think are going to be beneficial or that you've heard is the next great thing as you ask about prescription medications today. So, and keep asking. Ask as many questions as you can, because what if there were no hypothetical questions? We would never have gotten as far as we have today. We have a long, long way to go to continue to treat Parkinson's disease. So keep asking questions, because maybe your question is going to be the one that puts us on a new path to send us in a direction that we find a new therapy. So keep asking questions, please. So I appreciate your time, your attention. I don't know if you guys have written down questions. I think what we're going to try to do is gather up all the questions and then answer them in the format of the messenger rather than trying to have a panel right now. I know we've had one question right now, but I don't know if there are any others right at this minute. But I appreciate your time, your attention. I know this has been a long, long morning. So thank you.
A great set of talks. Thank you all for your attention, and just bear in mind that there are thousands and thousands, armies of scientists and doctors looking to find treatments that are truly of benefit for you, and none of us have any interest or would benefit from concealing that or hiding a truly effective treatment from our patients who living with Parkinson's disease and that need help. So anybody that claims to have a magic cure that nobody else knows about, particularly specialists in the area, I would definitely treat that with a huge grain of salt. Thanks.